Periscope, time to do some questions. So I'll go ahead and turn around the camera here so I can see. And you can see me giving answers. I guess I could take the hat off because I'm in the shade. And glad to have you guys join us. Jacob, we're glad to have you here and be a part of this Ask Dr. Vaughn. And Rashin and Tia Gabby, we're glad to have you here too. And whoever else is coming on, we'll just go ahead and have a little session here today and this afternoon. 1221 Dot, always glad to have you join us. And you always have good things to contribute. Oh, thank you for asking. I'm doing well. How are you doing, Kaylin? And Jacob's got a good question. Oh, I love the hearts too. And Hiker joined us. Thank you for joining us. What is your good question there that you have for us? We're excited to have the first question of this session come up. Yes, Kaylin, good to see you too. You like that? That's kind of nice looking there, isn't it? Kind of a summer scene. I suppose you guys could probably check the map and see where I am. I was thinking about titling this session, Where in the World is Dr. Vaughn? But then I realized on Periscope, you know exactly where I am because you can just use a little map and you see where I am. It is, isn't it? Yeah, I left a very deserty, drought place and came here for a little bit. Will having more than one ibuprofen at 6 hours hurt you? No. Am I in Ohio? Does the map look like I'm in Ohio? It's closer than usual. Shannon Grosskreutz, we are glad to have you be a part of today's session. And we do have a good number of people checking in. And I'm sorry that my face is so dark in contrast to the beautiful background. Oh, hey, Shannon. Oh, and thank you for the hearts, by the way. Yes, warm and humid, especially when you're running. It's quite humid out here. Yeah, Jacob, it is warm. It's warm and a little bit of a breeze right now. Just wonderful to enjoy for a little bit of break in the summer from being in the office. So what was that wonderful question? More than one ibuprofen in 6 hours. The limit that we usually use in dosing ibuprofen is roughly 100 milligrams per hour, or 2,400 milligrams in 24 hours, and that's the prescription dose. But little dose, big dose, it's just increased risk of having irritation of the stomach, and also risk of injury to kidneys. And you want to drink a lot of water when you're using those anti-inflammatory medicines, and take them with food because they are hard on the stomach. Stomach and kidneys are the two biggest concerns. Of course, they can also, now you've seen in the news, there is a degree of risk of increased risk for, I believe it's heart attack that was in the news, that you guys may have seen some studies on that. That's not unique to ibuprofen though, that's true for all anti-inflammatory medicines. At what point in medical school do you get to choose your specialty? Well, it's interesting you say it that way. I'm not so sure we have the choice. What you do is in the fourth year of medical school, you apply to whatever residency you want to apply to. And you're free to apply wherever you want, whatever specialty. You can even apply in multiple specialties. And then you go and interview at the residencies that choose to have you interview. And then after that, there's an interesting process called the match. And this is somewhat unique to medicine. It's a big deal. Every medical school in the country on the same day has all their fourth-year medical students open up their envelope to see which residency they matched with. It's done by a central computer that takes the rankings of the residencies and the students' rankings of the residencies rankings of the students, and gives the best match possible. And when it could go either way, as far as who would get their preference, the student or the program, it gives it toward the student's benefit for them to get the residency of their choice, or the next one up on their list. I got my third choice being the one that was in Kansas City for emergency medicine. My second choice was emergency medicine at Loma Linda University. My first choice was emergency medicine at University of California at Davis. And then the ones I didn't get, my fourth choice was Christ Hospital in Chicago, also emergency medicine. And then fifth, I believe, was Peoria's program, Peoria, Illinois, again, emergency medicine. Yeah, it's very interesting. Match day. I'm sure you could probably find a lot of YouTubes of medical schools match days where you see people rejoicing and jumping up and down, and you see people crying because they found they didn't get the best specialty they wanted or didn't get to go where they wanted. Is it possible to have bacteria in your bloodstream without being sick? Yeah, transient bacteremia does occur. Neither. Yes, you spelled neither correctly there. Why can't you take immunity booster if you have the flu? What is an immunity booster? Is that something by mouth that helps your immune system work better? If so, you should have taken it before you got infected. If someone is unhappy with their match, do they get to try again? Okay, you bring up an interesting point there too. You don't have anywhere to go if you didn't like your match. You can try to find a place that didn't fill. Usually it's family medicine, and usually it's not a program that's very desirable to be in, or internal medicine. They'll have spots go unfilled. For example, if you wanted to work in an inner city program that doesn't pay well and has horrible conditions, not only for the patients but also for the residents, you could probably find something like that that didn't fill and be able to go to work there. There's also the question that I think of when you asked your question, that is, what happens to the people who don't get a match? And it's the same thing for them. They're notified a day or two early. They're pulled from their residency and they're given, or from their medical school rotation, they're given the day off, and they spend the whole day on the phone, or I guess it doesn't have to take all day, but they spend time on a phone that the school gives them, calling, scrambling to get into slots that didn't fill. And of course, for my specialty, emergency medicine, the only place I know of off the top of my head back then that was known for sometime having slots was MLK program in Los Angeles, a program that was known for, at that time anyway, I hate to say something bad about it if it wasn't true, but, oh, father evaluated by hospital, I'm sorry. And as a doctor, someone who is older than college age, do you think it's too late? No, absolutely. I encourage you to apply specifically to St. Louis University. They have older students. One of my classmates was 50 years old when we graduated. And, okay, yeah, evaluation for hospice is just simply looking at the situation and seeing if death is expected, if the disease takes its normal course within 6 months. And if the patient truly wants to just be comfortable. And oftentimes now hospice is at home, thankfully, which is wonderful. Being able to be at home, take medicines that you need to keep you comfortable, only doing treatment for things that you're going to be able to actually make a difference in, like bacterial infections that transiently come, whether it be urinary tract infections or pneumonia. You kind of have the option of treating those or not. If they're having symptoms and you can get rid of it and then just continue on living, go ahead and treat that little hiccup that comes along, but not do chemotherapy, not do any operations, not be taken to the hospital, but just be made comfortable. And so that's what they'll be looking at, if that would be a situation that worked for your grandpa or your dad. What's the difference between a morphine and an IV? Morphine's a medicine. IV is a route of administration of medicine. I didn't catch that other question there. Now, somebody's asking about taking malaria pills. Malaria pills are usually referring to something you would take to keep from catching malaria. There are antibiotics that are used for the treatment of malaria too, antibiotics, and actually it's the same medicines. The dose you take in the prophylaxis or prevention is a much lower dose, just once a day. Well, 1221, thank you. You are very welcome. We're glad to have a conversation with you guys today. And I'm sorry for the weird color. It's this shade that I'm under. Annual income approximately for anesthesiologists. I would believe anesthesiologists, I'm just going to throw a number out. I'm going to say 170, 180,000. That's a guess. I do not know. I'd guess for nurse anesthetists that it would be less. When it comes to anesthesiology, it's just a matter of if that's a lifestyle that you would like. Lots of early mornings and sharing call to have to get up in the middle of the night for cases when you're the one who has the pager or is covering call for a week or a period of days. But for the most part, it's early morning to mid to late afternoon. That's their usual schedule. You don't have a relationship with patients, so that aspect of medicine is not a part of being an anesthesiologist. I mean, you meet them. You meet them just before you gas them. That's about it. For the most part, your patients are unconscious while they're under your care. And for me, that would not be all that satisfying, so that's why I didn't go into it. Oh, I recommend primary care if you want to have ongoing, long-lasting relationships with your patients. I recommend the emergency medicine if you like doing procedures, but also like to have a bit of a life outside of work. If you love doing procedures and performing before an audience, I'd say surgery, being in an operating room with a whole operating staff around you. If you want kind of a balance between a good income but somewhat of a good lifestyle, maybe an internal medicine subspecialty, or you could have a very good income because you're doing procedures, but at the same time be able to share a call and no, I did not move. Somebody was trying to get me to move to the Midwest. No, I have not moved. I'm just visiting and enjoying quite a nice visit. Jacob, thank you for joining us. We're glad to have you be a part of this Ask the Doctor. And those hearts are wonderful. Who is doing those hearts? It could be Kaylin, who's done 1,500 all the way already. Shannon's done a couple hundred. You guys are so nice. I really appreciate that. Thank you. Oh, you don't have to stop just because I thanked you. And if you guys really like this, and where am I currently? I'm in the middle of Nebraska. Nonstop taping for the best doctor. Oh, tapping. Yes, thank you, Kaylin. You're doing a good job of it, too. Pain and no one knew where it feels like you need to stretch leg at all times. Okay. And you guys notice I don't answer every question that comes across, especially the ones that are phrased more like I have or please be my doctor on this problem. It's more just conversation about medical topics that you guys may have interest in. And some guys, I say guys, I'm sorry, some people who participate just have wonderful comments about how they appreciate just being able to get a better understanding of something either they're going through or a loved one or something they just heard about in the news. Not necessarily me being a doctor or a second opinion, just more information. That's the way it works best. I was going to say, I don't know if I did earlier, that if you have friends who enjoy medical topics, you can swipe right and share. What's the difference in income and schooling becoming a physician assistant? Oh, good afternoon, California Sherry. We're glad to have you here, too. Okay, so Lyme disease, just look up Lyme disease at medicallyspeakingradio.com or at the Auburn Medical Group YouTube. Look up Lyme disease because we've done lots on that, and I've archived them for you so you can see that without interrupting our conversation here about, income and other training difference between a PA and a physician. PAs can do various specialties, but usually we think of them being primary care. They after college will need to have 1,000 to 2,000 hours, depending on the program they apply to, of experience in the medical field, which means you're working for a year outside of college, either before, during, or after, in addition to probably getting a bachelor's degree in a health-related field or biology or chemistry, and then do 2.5 years of actual training, which usually includes about 10 to 12 months of rotations through hospitals, actually learning while doing, kind of like a medical student does, and oftentimes on the same rotations as medical students or residents or both of them, going into the various specialties. And then your income when you get out is around $45 to $50 an hour. Oh, what's that come out to? I guess maybe around 90,000, 100,000. Usually, well, physician's assistant, at least in California, you're working under the supervision of a doctor. So you're not ultimately responsible if something were to go bad. You've got a doctor who's going to back you up and carry that. Also in California, you're not supposed to work without a physician in the same building, whereas a nurse practitioner can. That's the difference between them. Although PAs and nurse practitioners really otherwise in California are almost interchangeable. So you're seeing that you're getting really good pay. You're getting paid more than half of what the physician gets with way less than half of the commitment up front for training beyond college. And usually a better lifestyle as far as not being the one on call, although oftentimes physician assistants will take primary call for their doctor, and then the doctor will back them up. Have everybody done AEM? I don't know what AEM is. WMG. WMG. EMG. Electromyogram? Never done an electromyogram. Oh, thank you, Kayla. I'm glad you appreciate it. And I like talking about the training process and encouraging people to get into medicine. Something I think about quite a bit is we're transitioning now to have a nurse practitioner work with our team and actually ready to start interviewing for full-time nurse practitioners, thinking that we may be able to get to a space big enough for another provider in the next, 7 months or so. Yeah, Kaylin, remind me what part of the country you're in, and maybe I can give some extra advice based on that. Appointment for EMG. EMGs is where they actually test electrical conduction through muscles. You do feel a little electrical shock going through it, kind of like holding on to an electric fence. And they do have to put the needles in the muscle, which is kind of unpleasant because it goes through the skin into the muscle. It's not so cool. New York City. I don't have as much knowledge about New York City, being other side of the country from me, so can't give you a whole lot of details on programs or the medical community out there. But there are people who can, who are on Periscope, like in Connecticut, there's Dr. Flock. He's a surgeon, so he may not be as in touch with primary care, although, who knows, maybe he has physician assistants in his office and he can tell you a little bit about that. I also encourage you to learn about nurse practitioners. It used to be that nurse practitioners would have to go all the way through getting their nursing degree and then usually practice as a nurse, but not always, and then do the nurse practitioner program. So they're really coming from the nursing point of view, but now they have these programs that you can do with any health-related, maybe even any bachelor's degree, without being a nurse and become a nurse practitioner. So that should be looked at also. Slightly different requirements, slightly different experience, very similar pay, very similar work conditions. And just like PAs, you can find them in almost any specialty. I think of in our community in Auburn, California, a guy named Travis. I've not met him in person yet, spoke with him on the phone. He works in an orthopedic surgeon's office. He'll see patients pre-op and post-op on behalf of the surgeon, and then he's the assistant during the operation. So he's really with them from beginning to end without necessarily being the technician that does the main part of the operation, although he certainly does play a role in it. And that's a physician assistant doing, that working side by side with the doctor there, even seeing patients primarily, just not being the one who does the main procedure in the operating room. So if you don't have to be the main person doing all of the, being able to do every step of the process, but you like to be a big part of it, PA or nurse practitioner is a good role. It fits that. Should people get a CAT scan every year? Absolutely not. CAT scans are much radiation, and we're thinking now that some people may be getting cancer from getting too many CAT scans. I'm glad you like it, Kaylin. I'm glad you're a part of the group here. I encourage people not to get CAT scans not only because of the radiation. Of course, they're necessary if there's something that needs to be found. If you have abdominal pain that's unexplained, acute abdominal pain, it's perfectly appropriate to get one in that setting. Or if you had a head injury and mental status changes, absolutely get one. But just for looking for kicks and giggles or thinking you're going to catch something that should be caught, absolutely not. It is not worth it. And also all of the false positive things, all the things in the liver and the kidneys that show up that normally are there, but we don't know what they are, so they have to be followed up. That's awful. I'm sorry, I didn't catch all that comment on the radiation. But lots of radiation, especially with abdominal CAT scans, chest and abdomen, especially if you have contrast, and so they have to repeat the whole scan with the contrast. Oh, people being sick, huh, Kaylin? Well, don't take antibiotics for colds. Don't do that. That's not helpful. All that does is kill off good bacteria and cause side effects and put you at risk for allergic reactions to antibiotics. Colds, they go away. That's what they do. They're miserable and they go away. So treatment, just, if you're achy and feverish, the Tylenol, ibuprofen, rest, good sleep, which sometimes is hard. A lot of times the Tylenol or ibuprofen will help with getting good sleep because it helps to take away the fever, which interferes with sleep. Advil every day. Some people benefit from Advil every day. A lot of people with forms of arthritis really do benefit from it, but the problem is it puts you at risk for those problems with the kidney down the line, or it can be hard on your stomach. Nuclear medicine is a field of injecting radioactive isotopes into patients for studies or tests, oftentimes done in the radiology department. And this will be allowing you to get a nuclear scan of the heart or the lungs. The isotopes will go to areas of activity or inactivity or metabolic activity to show you where something is going on. One that's done is a VQ scan, ventilation perfusion scan of the lungs, when people are looking for if a person has a pulmonary embolism, and it'll have the whole lung, or normal lungs, will fill up when you breathe in the radioactive isotope, and you see that in one image. And then you'll have the blood go through with the radioactive isotope and show what parts of the lung are perfused. And then you look to see where there's a mismatch, where the lungs are perfused by air but not by blood, and that tells you there's a blood clot in that area, a mismatch. So that's used sometimes. By the way, it's a horrible test because it's not very sensitive or specific. For the heart, they'll look for areas of the heart that aren't getting oxygenated well during the heart under stress, and they'll tell you that maybe the arteries going there are getting blocked. Does an MRI have less radiation exposure? MRI has no ionizing radiation whatsoever. It only has a magnetic field. And as far as we know, it's not doing anything bad to people. I have difficulty breathing through my nose. I've tried Zyrtec, Zicam, and others. Yeah, generally for people who, I don't know what your problem is, but oftentimes when people are having difficulty breathing through the nose, we'll check and look for obstruction, look for a septal deviation to one side or the other, look for excessive production of mucus. Generally, under a normal exam, treat them for just rhinitis, allergic or non-allergic. The treatment's the same. You just use usually steroid nasal inhalers like Flonase or Nasonex, which are over the counter now in the United States. Flonase, the generic name is fluticasone, so you should be able to find that for a good price. And then you have to use it daily and lean over forward like this so that the stuff runs out of your nose, not snorting it back into your throat. It's not where its action is. And generally in a couple of weeks, it'll start making some improvement. Should people get an annual MRI to see if cancer is forming in the body? No. Again, the reason is because these things are done they're used correctly when you have a certain pre-test probability, meaning before you even start the test, you already have a level of suspicion for something being there that you're looking for. And that increases the sensitivity for finding that thing you're looking for when you do the scan compared to somebody that you don't think has it. So it's much more accurate when it's used on people that you know what you're looking for, meaning less false positives. And then the problem, of course, is these overdiagnosis or over sensitivity, decreased specificity situations where things are found that we don't want to find. We don't want to know that there's a benign hemangioma in someone's liver. We don't want to know that there's an area of a difference of density in their liver that's not a cancer that we're going to do something about, because then we have to go try to figure out what it is or live with this unknown if we don't do further studies to get it worked up. Is a CAT scan more accurate than MRI? Depends on what you're looking at. For bone, absolutely, CAT scan is the better tool for looking at bone. MRI is usually better for soft tissue. Of course, that's a generalization that doesn't always apply. So they're used for different things. Thank you for being on the caring side of doctors to us. My doc's good. Like you, thanks. I'm glad you have a good doctor, 1221 Dot. How are we doing here? Does this thing have a timer on it? I don't think it does. But California's my favorite place in the world. Kaylin, why do you live so far away from it? You'll have to go to school in California. That's what you have to do. Or maybe for graduate school, because it usually costs more to go to another state for college. They prescribed me antibiotics to treat a UTI. That is correct, because they kill off the bacteria that are causing the urinary tract infection. They do a good job of it. Unfortunately, sometimes you get side effects with it. Okay, thank you, guys. Oh, Danielle, you just showed up. Did you see where in the country I am, Danielle? Did you see that I am like 4 states closer than usual? I'll wait till Danielle greets me here and then probably wrap it up, I'm thinking. But as usual, I encourage you to share with your friends. We do have a new podcast coming out Saturday at 10 o'clock at medicallyspeakingradio.com, and then it should be on iTunes within a day or two. And I've already forgotten what the subject is because this has been such a fast week to get everything done that we needed to before getting out here. Kaylin, thank you for sharing. I'm glad that you shared and invited followers. We are so glad to have you share us with your friends and your followers so that they can be a part of the discussion, because I enjoy talking about medical topics, and a lot of other people do. Is Alive just a lesser dose of a prescription med? I think you're asking about Aleve, I'm guessing. Yeah, actually it is. That is correct. It's the same thing, just a little bit different. Oh, the brain amoeba. Yeah, that's what the topic was. If you want to hear about the brain-eating amoeba that's in freshwater lakes in this country, probably in most of them as you get further south, although you can't even find it in Minnesota, that's almost uniformly fatal, listen to Medically Speaking Radio, specifically the show that will be released Saturday. Okay, guys, Kaylin, yes, thank you so much. Thank you, everyone, for being a part of things. Danielle, I did see you, even though you didn't say anything. We know you're there. And we look forward to doing this with you guys soon. Don't know when, but I love doing it. Try to do it daily if I can. And we will see you again in the next time. Until then, this is Dr. Vaughn telling you to stay in good health.